Good morning to you. It is November 12th. Tamika Chambers, NCLEX Coach Tutor, here with another question. As always, I encourage you to have something to write with as you do questions with individuals, as well as write or state your answer before they do, as well as your rationale. So you are making a home visit to a 50-year-old patient who was recently hospitalized with a right leg deep vein thrombosis and a pulmonary embolism. The patient's only medication is enoxaparin, Lovenox subcutaneously. Which assessment information will you need to communicate to the physician? So we want to sum this up. We have someone with actually a 50-year-old client recently hospitalized with right leg deep vein thrombosis and pulmonary embolism. They're only taking Lovenox. Which assessment finding needs to be communicated to the physician, or in this case, it's urgent, right? Usually it's something that is abnormal that needs to be communicated. So definitely my keywords are going to be 50-year-old patient, right leg deep vein thrombosis, recently hospitalized, pulmonary embolism, enoxaparin, need to communicate to physician, assessment finding, need to communicate to physicians, right? And so we're going to go ahead and read through, and I just say go down one at a time. There's no tricky way. You're not working the answers, you're working the question, right? The situation, the statements, the scenario. So would it be the patient says that her right leg aches all night, or B, the right calf is warm to the touch and is larger than the left calf? C, the patient is unable to remember her husband's first name, or D, there are multiple ecchymotic areas on the patient's arms. So go ahead and select your answer and then pause, select your answer and then come back, all right, with your rationale. So we're looking at this keywords again, we're looking at the relationship between what? Right, and I always include the age just to be on the safe side. So 50-year-old, right leg, deep vein thrombosis, pulmonary embolism, enoxaparin, and assessment findings. So we're looking at what should I report if someone is on with this condition, on medication, what's something abnormal that needs to be reported, right, typically. All right, so her saying that her right leg aches all night, that is pretty symptomatic of what she's going through, right? The healing process. The right calf is warm to touch and is larger than left calf. May need to do some education regarding that because, making sure that there is some elevation going on. But we're talking about something that's typically urgent. There are multiple ecchymotic areas because she has some bruising that is possible with Lovenox. One of the things that, is very important to remember is anytime they're on heparin, low weight heparin like Lovenox or warfarin, we have the increased risk for bleeding, right? And so C, it's unusual for her to remember her husband's first name. What could be going on? She could be having some bleeding going on, specifically in the brain, right? And so here is your rationale: confusion. That is unusual. Like I said, that is pretty scary. Something's going on here. So there's a change in mental status. And especially I think too, just even add into it that if she has a history of clots, you also sometimes even think about, but it specifically tell you she's on Lovenox, but you start wondering, that clot moved. But here's the biggest concern is there bleeding going on in her brain? So she would need a CAT scan, right? And she would need to be further assessed regarding that. All right, you guys, take care of yourself. Remember, you can do this. Check out the relationships, check out the keywords. And if one person can do it, you can too. Talk to you guys soon.